Good morning. How many of you have been or know someone who has been affected by addiction? Out of those who didn't identify themselves, who has been but is too ashamed or embarrassed to say so? The negative stigma of addiction prevents some people that need help from stepping forward for the help. Junkie, crackhead, drunk. We've all heard these derogatory terms used to describe someone suffering from an addiction. They are filled with judgment and are shame-inducing. Even with scientific progress that has been made, many still think that addiction is a moral failing and a conscious choice. Who wakes up with the goal to become an addict? According to psychiatry.org, addiction is defined as a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. Addiction doesn't just affect the individual who has the addiction, but it also affects almost everyone that their life touches in some way. A survey from Vox.com indicated that half of Americans had a family member or knew someone that had a drug addiction. And according to the National Survey on Drug Use and Health, 19.7 million American adults battled a substance abuse issue in 2017. Addiction does not discriminate based on color, ethnicity, gender identity, or social economic status. It is considered both genetic and environmental. The National Institute of Drug Abuse claims that based on sibling studies, as much as half of a person's risk of becoming addicted is genetic. The other half is due to poor coping skills, such as dealing with stress, a trauma, or uncomfortable emotions. Children of addicts are 8 times more likely to develop an addiction themselves. The newest drug epidemic is the opioid crisis, and unlike some others, it has found its way into urban, rural, and well-to-do suburban communities. In 2017, the Health and Human Services declared a public health emergency. Overdoses in 2016 totaled more than 42,000, more than any previously recorded year. This rise in deaths came in 3 different waves. The first wave appeared in the 1990s with an increased amount of opioid prescriptions. The second wave appeared in 2010, and it had a large increase of opioid deaths due to heroin. The third most recent wave was a large increase in 2013 of overdose deaths linked to fentanyl use. Fentanyl is a synthetic opioid pain reliever, normally used for severe pain such as cancer patients. It is 50 to 100 times stronger than morphine. Most of the fentanyl on the streets today is illegally made. Overdose prevention is always preferable to emergency treatment, however not realistic in today's drug culture. Ways to lessen the chance of death due to opioid abuse are improving prescription methods, educating the public and medical professionals to lessen stigmas, providing quality treatment for those who have a problem, and ensure that Narcan is available to emergency workers, police officers, and others who interact with a population prone to opioid abuse. It is important to realize that even though addiction may not have touched your life yet, it does not mean that you are immune to it. Treat others the way you would want yourself or a loved one to be treated in that case. I don't know that addiction will ever be eradicated, but together we can help support each other and hopefully lessen the loss that it does cause. Thank you.